will be. Luke will start the recording when you're ready.
Yeah, if you can start the record, that's great. Excellent. I have got no pictures of anybody apart from myself. Right, yeah, I've got no pictures of anyone apart from who's talking. Right, ladies and gentlemen, councillors and members of the public who are watching it, welcome to Health and Wellbeing Overview and Scrutiny Committee on Tuesday, the 2nd of March. As I say, I only have a picture of myself and whoever's talking. I've got a list of the hands, so if anybody raises a hand and I don't come back to them, Chris, can you give me a shout, please?
Certainly, Chair.
Thanks, Chris. And we go on to the agenda. Item 1, apologies for absence. I've seen Councillor Dodds. He was hoping to get here and he's managed it, so that's the only apology I have. Have we any other apologies?
The only other apology I've received, Chair, is from Councillor Simpson. Thanks
for that, Chris. Go on to item 2 on the agenda, which is the minutes. Now we have, if you remember, we didn't have the minutes at the last meeting for the previous meeting, so we have 2 sets of minutes, one for the 12th of January and one for the 2nd of February. I'll go through the 2nd of February first. If anybody has any comments on those, please raise your hand. I can't see anybody raising their hands. So we go on to the minutes of the 12th of January. Again, if there's any issues, could you raise your hands? And again, I can't see any hands. Do we all accept the two minutes?
Agreed.
Thank you. Thanks, Kath. Disclosures of members' interests. I haven't been given any. Chris, have we received any members' interests?
No, I haven't been sent any.
Thanks, Chris. Appendix A, the forward plan. Chris, do you want to go through this?
Thank you, Chair. The forward plan's there for members to note. There's nothing on there specifically for this committee.
Yeah. Everybody note? No questions on that? Thanks, Chris. And we have the minutes of the Health and Wellbeing Board from the 14th of January 2001. Councillor Chair. Can we take those as read? Yeah, great. Moving swiftly through. We go to Appendix C, COVID update, and we have Rachel, I believe, is presenting this one. Rachel.
Hi, thank you very much. Hopefully Chris can just load up those slides for me. That's brilliant. Thank you so much. So this is an update on the vaccination programme as opposed to sort of generally on COVID. So I hope that is what you were expecting.
Yes.
Good. Right, I'm just going to see if I can move that slide on. Hang on. I can't. I'll just. Sorry, I've just requested control, but it won't let me do it. So I'll just hand it back to you, Chris. If you could just give me the next slide, please. That works. Oh, brilliant. So this is just really a reminder that I do on all our slides, just about the key message really is very much around trying to encourage people to wait to be called, although I appreciate that is really difficult for people, but that is still the message that, you know, the NHS will contact people when it is their turn. Next slide, please. So just to give you an idea of where we're up to, amazingly, we're only on sort of week 12 since we started this programme, so it is still a relatively early days. This is data across across the northeastern Yorkshire, and this is how many people have been vaccinated to date. So we've had over 2 million there, which is about 34% of the eligible population. Of that, across the northeastern Yorkshire, 94% of care home residents and 75% of the staff have been vaccinated, and 91% of the clinically extremely vulnerable population. Next slide, please. So just trying to get a little bit more local, across our ICS, the North East and North Cumbria, 846,000 people have been vaccinated, which is 34% of the population. And then for Northumberland, we've done 102,831 people, which is a slightly higher percentage of 38% of the population. 70,500 of those vaccinated are over 65 years of age, and 88% of the total population over 65. So that just gives you a little bit of an idea of where we are with the numbers. As you know, this is a nationally run programme, so we don't have sight of the data, which is frustrating for us, really. Next slide. So I'm totally aware that I have been to several of members' meetings, but just from a scrutiny point of view, I just thought it was worth reminding people where our primary care local vaccination sites are. So there's obviously a map of Northumberland, and the sites are the blue stars. So Valence PCN has 2 sites in Cramlington and Ashington. Cramlington PCN has a site also in Cramlington. Blythe has a site. Wansbeck is operating from Ashington Cricket Club, and then over in the west we've got 2 sites, Ponteland and Hexham, and in the north we've got 3 sites, Alnwick, Coquet and Berwick. And also just reminding there that we do have we have commissioned some transport services to help people get to those sites. Sorry, next slide please. The hospital hubs, you remember, were vaccinating health and social care staff. They've actually completed their staff now. So Newcastle Hospital has completed theirs. Northumbria vaccinated 18,000 staff across Northumberland and North Tyneside, and across health and social care. And CNTW have vaccinated over 80% of their staff as well. The hospital hubs weren't given another cohort of people to vaccinate, so they're sort of paused at the minute until they start doing the second doses of those staff groups. So that's the position for the hospital hubs. Next slide. Just to give you an idea of from a point of view of Northumberland social care staff, the sort of a list of all the groups that we managed to get, both employed directly by the local authority and contracted, so such as home care staff, and the numbers in which we have vaccinated, and still there are still some people to continue to vaccinate. Maybe they've had COVID and we're in the 28 days, or have chosen for whatever reason to not have the vaccine, but we have done really well, and this is a good graph to just show how well we've done across the other areas too. Next slide please. This really just shows a list of, when it turns up, there it is, of healthcare staff that we've vaccinated. So again, we've learned about pharmacists and dentists and optometrists and all those services that we don't actually commission, and looked at all our commissioned services like hospices, vocare, and really have been very inclusive of everybody that's out there that's doing frontline care, and very much a team effort across the local authority, the CCG, the FTs, the local medical and pharmaceutical committees, etc., have been really helpful in identifying a lot of these places, because some of these aren't even services that we actually commission. So we've had email addresses that people have been using, and then the CCG have coordinated the list just to make sure everybody has been covered. Next slide please. We still have a vaccination centre, so as you know probably from previous presentations, our closest site currently is at the Centre for Life, and they use a different system, which is the National Booking Service, and so they that's nationally organised, where they write letters to particular cohorts of patients that have been agreed nationally, and then people can use the link or a direct line phone number in order to book onto those services. What we have done, and hopefully you all got a stakeholder brief that we did last week, and we put some messages out in the press that actually, you know, people can still choose. They can go to that site if they wish, but they can still wait and go to their primary care site if they want to go locally as well. So there is a choice for people in that sense. Next slide, please. So just to show how we are moving down the cohorts. So obviously the first vaccine has now been administered to the first 4 groups, and we are now busily working on the next groups between the 5 and 9, and the deadline for this is the 15th of April. So it's a very busy time for primary care, particularly on all the vaccination sites, because not only are we going to be moving down the cohorts, but we also need to return very shortly to do the second doses. Next slide, please. So as the national team are looking to increase capacity, they made a decision around cohorts 5 and 6. That they would sort of split the work, which is what I just alluded to before. So cohorts 5, which is your 65 to 69-year-olds, were part of the national booking system, and they were all sent letters in order to use either community pharmacy sites or the national booking Centre for Life, or others are available but slightly further away. And cohort 6, which are the sort of 18 to 65-year-olds within those at-risk groups. So I think we've discussed before about those people that ordinarily get the flu jabs fall broadly into that category, but there is a very clear clinical list of people that are within that group, and the other group in there are the unpaid carers, and actually we've been working really closely with Carers Northumberland, who have really helped to identify those carers. GP practices have registers of carers, and also lists of people that do claim a carer's allowance, is kind of broadly how we've tackled that particular one, and supported primary care through that. We currently don't have any community pharmacies in Northumberland designated, but I'll update you on where we're getting to with that, and we don't have a vaccination centre either in Northumberland. So we were just really keen to pass on the message that our GPs are very keen to vaccinate, and they will get to those people. So it is just a case of waiting to be contacted if a patient chose to stay within primary care. Next slide, please. So I think I've probably covered this actually. This is really around cohort 6, which I've just said about the high risk patients and those receiving carers allowance. Next slide, please. So very much gearing up for second doses. We actually have already started that this week for some of our practices. If you remember, when we started the programme, we started in waves across the PCN, so they're all obviously operating now, but there was a sort of staggered start. So the first practices to start have started doing their second doses. This is happening within sort of week 11 plus or minus 7 days, because we're trying to do it within that 12-week window, and we've been getting lots of information around that supply of vaccine, just to make sure that it's the same vaccine people had at the start to their second dose, because they have to kind of match across. So we've started that, and the hospital hubs will be also helping with those patients that had a reaction to the first dose or have been advised by a clinician who might require that dose to happen in hospital. So those lists have been shared with the hospital, and the hospitals will support with that. And what we're really hoping, and what primary care are desperate for really, is to develop this more of a pull model. So at the minute the vaccine is pushed to them every week. They don't know from week to week how much they're getting, which makes it really difficult to plan. So what we're hoping for as we get more into the second doses, that they'll absolutely know who's coming for their second dose because they've already vaccinated them once, but then they would be able to pull an amount of vaccine for first doses so that they could staff those centres accordingly. But we are still waiting for that really. Next slide, please. So we've been looking ahead and working with primary care just to look at what the ask is ahead of us, because there is an enormous challenge. So as you know, we've got 10 primary care sites. And between December and February, over 11 weeks, we actually administered those 100,000 doses I mentioned in the earlier slides. So we now know that we have only got 9 weeks as we've been set the target for the 15th of April, and we have got 147,746 doses, which obviously includes those second doses. So it is a 63% increase on the number of doses required for those groups. And about 106% average increase in capacity required at each PCN site versus when they did the first wave. So it is a really big hike up for the PCNs. Next slide, please. So these are really just some graphs just to show the actual vaccine that has been coming into Northumberland, which you can see in blue up to the 12th of February. And then these are the sort of projected volumes that we require in order to get through the cohorts that we have been asked to do by the target. So you can see it is a really big jump. And next slide, please. So again, this is just the same information, but just presented slightly differently. So again, you've got the actual amount that has been done in blue, and this is per site along the bottom, and then the projection of where they need to get to in order to achieve the target going forward. So quite a big hike in activity for them. Next slide, please. Now, I have to say our primary care have been brilliant. They are absolutely up for the challenge and are really keen to continue to vaccinate our population, and they are doing brilliantly. However, this is a national programme, and nationally, because of the hike in activity, they are asking us to look at alternative solutions. And as a commissioner for Northumberland and for our population, we need to look at other options. So this is just to give you an idea of what we're looking at. So you will have heard me talk about a roving site possibly before, about having a van that could deliver between 500 and 1,000 vaccines a day and could travel around. And I've just put them on the map where they're in the green triangle, because the sort of 3 sites that we would be interested in looking at from a point of view of our geography would be Haltwhistle, Rothbury and Wooler as our sort of more rural areas. And it might be that every week we actually go to one of those sites, and then for the other 2 days of the week we might pick other sites looking at some of our health inequalities, maybe some of our harder to reach groups. To do those. I have to say we've worked closely with the local authority. We've had lots of offers of village halls, and I think that is just absolutely brilliant. So I think there's quite a lot of enthusiasm for this roving model, and certainly as a CCG we'll keep an eye on the data and the vaccines and how much is going to each of the sites, and we can always then direct the roving model to a site that maybe is needed to catch up in order that we have equity across the patch. The sort of purple flag sort of sign is where we are looking at possibly a vaccination centre, so a sort of a building for people to go to, and the two areas. So we've been round this and back round this because we don't have an absolute natural centre, and actually that little flag isn't necessarily in totally the right place. I might need to move that up because I think what we're doing is looking for sort of Morpeth as a site and Hexham as the other, and at the minute the national team are just looking at potential sites and where that could be. So it might be that we have one site, or we might have two smaller sites doing say 500 a day, or we might have one site doing 1,000, just so that we've also got that option. And the other reason that we've come to look at that is because nationally, suddenly cohort 5 and 7 went to the national booking system, and we felt we needed to have a Northumberland choice for people to make rather than going out of the county. And then in time, hopefully, we'll have some little yellow blocks on there, which are the community pharmacies. So they've just had approval just last week, and we currently have, I think, about 7 pharmacists in Northumberland who are interested, and we just need to have a look at those, find out where they are, and make sure that they are suitable to provide for the vaccine, and that will also give people another choice as well, which is really positive. Next slide, please. So we've developed a vaccine equity board, which is very much joint between the CCG and the local authority public health colleagues, really just so that we are clear where our hard to reach communities are, where our priorities are, just so that we can make sure we don't miss their ability to access the vaccine as and when it comes round to their groups. And again, working with primary care on numbers of people that refuse and which they're coding, and then looking at whether there is any patterns between the groups of people that refuse and whether we can work in a different way to encourage or deliver the service in a different way. So so it has only met a couple of times, but I think equally it'll be really helpful for giving us some idea of where that roving clinic needs to be in order to get to those hard to reach groups. Next slide, please. So again, looking really to the future and looking to increase our capacity and provide more choice. These are the options which I've kind of mentioned around the roving model, which will help with the rurality and hard to reach groups, and will work very much in collaboration with primary care, and probably will be run by primary care and primary care teams. The vaccination centre, again, we're just looking for sites, and again, we'll work collaboratively with primary care with that as well, and then the community pharmacies who are also coming online. So that just gives you an idea of what they would be able to deliver, and that just gives us a little bit more choice going forward, but we're just waiting to hear back on some of those. And I think although primary care are very, very keen to deliver, we are mindful that they have core primary care to offer, and so we just want to protect their time as well, so that they can do both. Next slide, please. And then this is just really just a reminder really of the vaccination programme and what that actually means. So it is taking, we've got about another 4 weeks maybe of the vaccination programme before we really start to see some reduction in those hospital admissions and deaths. And we've probably got another between 4 and 6 months before we see a significant reduction in community transmission, as we're looking to get to about 70 or 80% of the population immunised. And as you remember, certainly for Northumberland, we're only at 38% at the minute. Some positive news around the AstraZeneca vaccine is 67% impact on reducing transmission, which is great, and there's lots of studies looking at the minute around whether we can mix the doses, because at the minute it's very clear that if you had Pfizer you need Pfizer, if you had AstraZeneca you have to have AstraZeneca, but they are looking at whether that can be mixed, and that's just a logistical issue for delivering the vaccine. And again, that key message, although I appreciate it's an anxious time for people to wait, and everybody probably now knows somebody that's had the vaccine and wonders why they had it before them. You know, these people won't be missed. They're part of the register of a GP practice. They will get letters and they will get their turn, but I do appreciate there's a lot of noise from people too, and a difficult time. And next slide just says any questions, and thank you very much for listening.
Thanks, Rachel, for that. That was really interesting and a lot of good news there. I got my vaccine last week up at Alnwick Cricket Club. Fantastically well organised, straight in, temperature taken, a couple of questions asked, no side effects, wait for 15 minutes, I think it was, and in a way, but unbelievably well organised. And if anybody has any fears about going, please don't. You don't even feel the jab. It's fantastic. Looking for hands up. I've got Councillor Nesbitt first. Councillor Nesbitt.
Yeah. No, it's just you know, it's a bit frustrating that you've got the railway in Blythe is doing a great job on the vaccines, but they could do at least about 700 a day, where at the beginning of March they only got 400 to share between Marine and them. You know, and I think with railway being the largest centre in Blythe Valley, it's just you know, of the two, it's just you can understand the frustration that people have got through that. So it's just more of a comment and just see what you could do about that to try and help. Because I mean, they are doing an absolutely great job on it, and it's just a shame that they can't get through more because of the vaccines they're getting.
Yeah, no, the supply is obviously nationally determined, and we don't have any control over the supply that comes in, and we have had a couple of weeks where the supply has been less, and it is difficult. We've obviously still had some, but not as expected. I think this is just as we prepare for the second doses, and I have seen we've had allocations in today, and certainly for next week. We have got a lot of vaccine coming in so that they can do their second doses and continue with the first doses. So I think it's just getting through that blip of getting the second doses underway as well. But I agree, it is frustrating around that.
Thanks for that.
I saw a report, Rachel, that we're down to our own success in Northumberland or the North East. We've been very successful at getting through a lot of residents, more successful in other parts of the country, and that's why I think people think that we haven't had the amount of vaccines we have. We have had the amount. It's just we've been very successful in the way we've rolled it out. Is that correct?
I think very early on in the process, certainly the North East were very, very high performing as an area, and accepted the challenge and got on with it very fast, to maybe the other parts of the country that didn't. So there was a feel that was the case, but certainly now we've moved away from that. I think we're all moving as a country at similar paces. So I don't think that's the case now. I think it's across the board, and we meet regularly across the North East, so we're not being missed out by any stretch of the imagination, and we wouldn't let that happen anyway.
That's what I thought. Thanks for that, Rachel. Right, I have Councillor Rickaby, Councillor Sesford and Councillor Bowman. Councillor Rickaby.
Thanks, Chairman. Yeah, I've got 2 or 3 things I'd just like to comment on. First of all, I suppose I was interested to know if you've got any data, Rachel, on the percentage of people requiring transport, but don't worry if you haven't. The second was any local data on the black community's uptake, because obviously we're hearing in the national news that they are sometimes reluctant, and I was just wondering whether that is affecting the North East and Northumberland at all. And I'm going to predicate this with, I have abject respect for everything that's going on. I endorse what John said. I've had my vaccination. It went just as John's did, and so on. But I'm really, really pleased that you are considering the large vaccination centres. Both my husband and I did get the letter to go to Newcastle, and we said, no, we're not doing that. We don't want to go on public transport, etc., etc. And I have to say that we were helped, but it was when they announced the 30 new centres across the country, and the nearest to here was Leeds. And when the young lady, who was very, very helpful, as I say, this is not criticism about the actual process, she was doing her best to try and find a spot, but my husband was being suggested to go to Wales, Cornwall, or whatever. So I think the sooner possibly that you can get the large vaccination centres going, we as the Northeast, people living in the Northeast, might feel a little bit of a bigger blanket round us and not being ignored. So it's not criticism. Ironically, in a perverse way, it's actually praise. Okay.
Okay, thanks, Leslie.
Thanks, Leslie. Councillor Sesford.
Yeah, thanks, Chair. I was in the cohort 6. That's how I got called up last week to go for my vaccination. So, and like Leslie and John both said, it was like a well-oiled machine. So I was so impressed with the way they were operating. They're fantastic. I just, Rachel, if you don't mind, can I just ask a question about the people who are not taking up this offer, i.e. they're refusing to have it, or and another thing, people who sort of take the booking but maybe don't turn up. I mean, it looks like we're having a very, very, very high percentage rate who are doing it, which is good, and probably even more than we thought. But is there still a few people who are refusing?
So we are starting to look at this. So I think within the older cohorts we had very few people refuse, and our uptake was very, very high. And I think as we are moving down, you are getting a few people that are refusing. So that's why we've got that equity board, so that we've got a group of people that can look at that and try and help understand why that is, because I think some people have very deep-rooted reasons and values for those decisions, and it's quite difficult to just do that quickly over the telephone when you're booking an appointment. So we're just trying to understand that wider issues and if there are any groups. So the GPs certainly code anybody that refuses, and then we can look at those sort of people, but there hasn't been many, but we're just starting to look at that, and that's not something hopefully we can bring back at a later date when we've started to understand that information a little bit more, but not too many. Which is,
do you think it's sort of more or less going to be random people refusing, or do you think there's going to be one particular age group that's going to be possibly too early for that, though? Seeing as
it's a bit too early to say, really.
Yeah. Okay. Thank you.
Thank you.
Thanks for that, Trevor. Councillor Bowman.
Thank you, Chair. My questions has been asked by the former member. Thank you very much for that. But I do want to comment about the larger vaccine centres. I think it was a brilliant idea to look at it, and it's rather strange, isn't it? But the people of Northumberland are proud to be Northumberlands, and it's a strange thing, but they don't want to go to Newcastle. And I know Newcastle's like the centre of the Northeast, etc. But the reason being is they're worried on their journey there. They might pick up something or whatever. But at the end of the day, you've done the right thing, and I really praise you for that. It is a sterling operation that you've done so far. And the other thing I would like to just ask a question. It's not a big concern, but it's when you book up for your appointment, you then arrange for transport, say with Age UK. But unfortunately, what I found that once older people have booked up their appointment, they've neglected in arranging their transport, and they've had to organise taxis, which can cost about £60 return. Which is rather a shame, but I don't know if that can be improved, especially when you're speaking to older people. Thank you.
Thanks for that, Liz. Rachel, did you want to comment on that?
I mean, Thank you, Councillor Bowman. I mean, it has come up a number of times, and we have kept reminding our practices around it, because it was for them to discuss at the time of the appointment that was being used. And I know Councillor Rickaby asked about the percentage requiring transport, and I don't know the answer to that, but we'll look at that, because I think it has certainly been well used. And we can just keep reminding them and promoting it, and particularly as we go through the second doses, it's a good opportunity just to do another reminder. So thank you for that.
Thanks, Rachel. Derry, you had your hand up. Would you like to ask a question, Rachel?
Yes, thank you very much. Rachel, no, it's just to reiterate some of the messages, really. The thing that we're getting about vaccination at the moment is the confusion around booking and having to go to one of the other centres, and I know that that's not within your control, and the comms around all that. So I would say I'm giving you that to pass upwards, really. I think when you mentioned that cohort 5 and 7 went to the national booking system, does that mean that they were allocated to be contacted through that? And I think that's what we're hearing. I think a lot of those people who are getting in contact with us have been approached, and I know that we've had sort of like people coming from saying, well, I've got to get from Manic to Sunderland, and that's really not easy for me, and all of those things. So I think the more local it could be, the better for that's what I think what we're hearing most. But certainly in terms of passing up the line, in terms of communications, this issue about, well, if you're contacted and you need, you're offered Sunderland or Durham, which is the other popular one at the moment, I think people still feel really worried that do they take that and then not contact their GP. So I think there's a lot of confusion, and anything you can do in terms of, we're trying to translate some of that for you as well, but anything that can be done in terms of good communications around that, I think will help put people's mind at rest. I think there's a lot of worry, which is what we're hearing.
Thanks for that, Derry. Again, Rachel, did you want to make any comment on?
Well, no, thank you, Derry. It's helpful, and we did put a press release out last week. We will continue to do that. We've had it's been very difficult for us because we've been it's a national programme, national comms, and so it has been frustrating. I can see Claire Riley nodding there, because absolutely it's been frustrating, and in the end actually it was Claire that said, look, we've just got to get some comms out, and so we will continue to do that and use our social media as much as we can to get the messages. But that it is a bit out of our control. But Claire.
Yeah, just to reiterate Rachel's point, this is a nationally led programme, and actually regionally Newcastle are leading on this on behalf of the national team, and they've been really helpful in supporting us. But I'm conscious that certainly in Northumberland, we're used to probably being a bit more proactive than we've been able to be from a communications point of view, is probably the best way I can put it. However, in recent weeks, you've probably seen an increase in communications in this area. Derry, if you can help support us in pushing these through your networks, if anybody else would like access to any communications we're issuing, please let us know, and we'll make sure that you get it. And you can forward through your networks, but we'll continue to do that as and when we can, really.
Thanks for that, Claire. Good. Derry, are you happy with that? Councillor Rickaby, Leslie, is that your hand up again?
It's my hand up again.
Right.
Yeah, I wanted to make a comment from Councillor Sesford's comment about the take up, and again, I don't know whether Rachel's come across this, or maybe I'm trying to possibly highlight, I'm going to use the word problem, because the younger man that delivered our food delivery the other day was adamant about not taking up the vaccine because he's young and he can fight it, and everything's going to be hunky-dory. So really, I mean, I'm not teaching Rachel to suck eggs, but I think that's the cohort that maybe we're going to have to look at, the people that think they're totally invincible and still not realizing the impact that they could have on the vulnerable.
Yeah. Rachel, did you want to make any comment on that?
I just wonder if Claire wanted to comment on that, actually.
Yeah.
Thanks, Rachel. Thanks, Councillor Rickaby. There is some insight work ongoing at the moment just to try and unpick that, to understand whether or not the younger generation are more likely not to take up the vaccine than the older generation. So I think if we get the data behind it, it will certainly help inform certainly some of the communications and engagement activity that then can move forward with. But I think getting the insight work will be really helpful, certainly for us, for our public health colleagues too, no doubt.
Thanks for that, Claire. I can't see any more hands up. If there is, please shout out, but I can't see any more hands up. All I can do is pass on our thanks to both Claire and Rachel, doing a fantastic job as ever, and at all the centres that they are, as myself and Councillor Sesford have said, that fantastic work they're doing, and just pass on our thanks to the whole team, please.
I will do. Thank you very much. Thank you.
Thanks, Rachel.
Thank you.
Right, next on the agenda, Appendix D, we have a presentation on the Coroner Service. Andrew and Karen, I believe, are doing this presentation.
Thank you, Councillor. Chris, if you can share the screen, please, that would be great. Thank you. So thank you for the invitation to speak this afternoon. Andrew Hetherington is our still relatively new senior coroner for Northumberland. He joined the service in October 2020, and the service has been through a lot of transition over the last 12 months, apart from being part of a pandemic as well. Next slide, please, Chris. So I'll hand over to Andrew for this, because I know he would be grateful to have an opportunity to talk about the role of the senior coroner and the coroner service. So Andrew, if you'd like to take this slide.
Thanks, Karen. So hello, good afternoon, everybody. So I'd like to start by spending a little time just to explain what the role and duties of the coroner entails, what the purpose of an inquest is, and what changes we're seeing in Northumberland. So just to explain, a coroner is an independent judicial officer. I'm appointed but not employed by the local authority to carry out my statutory duties. So once I'm made aware that a body lies within the area, I have a duty to investigate if it appears to me the deceased has died of violent or a natural death, the cause of death is unknown, or the deceased died in prison or in state detention, so police custody. Now, it's probably a popular misconception, but an inquest is actually, it's an inquisitorial process. It's not adversarial. I'm not there to determine criminal or civil liability. The purpose of the inquest is to ascertain the answer to four questions. So who the deceased was, when they died, where they died, and how. And the question of how is interpreted by what means somebody came by their death. Now, if Article 2 arises, so somebody's died within the control of the state, it's a broader inquiry, so how will be interpreted by what means and in what circumstances. Now, there are certain occasions in which I'll be required to sit with a jury. So if there's been an unnatural death in custody or state detention, if the death's resulted from an act or omission on the part of a police officer or a member of a service force, or if there's been a death which is a notifiable death, accident or poisoning. So that would be circumstances, for instance, if there's a workplace fatality is the most common circumstance we've seen. I also have a discretion, if I want to, that I can choose to sit with a jury. We do have a prison in Northumberland, HMP Northumberland. We have secure mental health facilities, and obviously we have employers, so we do have a number of jury inquests. It's also part of my role to determine what the cause of death is, and in order to assist me, I can arrange or authorise what's known as a post-mortem examination. So that could be a standard post-mortem, which is invariably the most common type of post-mortem we have. Probably about 95% of all post-mortems are the standard post-mortem. I can have one which involves additional skills, is often referred to as an independent post-mortem. We can also have what's referred to as a non-invasive post-mortem, so we'd use CT or MRI scanning, and in certain circumstances I'll be asked by the police to authorise what's known as a home office or a forensic post-mortem. So whereas post-mortems are normally carried out on the balance of probabilities, if it's to investigate a crime, it's a much more detailed post-mortem, and that will be carried out to the criminal standard beyond reasonable doubt. We're also a county of treasure, which I'm very proud to say. We have a number of treasure inquests which are here. I have colleagues who are coroners in the North East and other areas, and they've never done a treasure inquest. I've got 14 on the go at the moment. We've concluded 3 already this year, so which is quite a different part of a role for me to do. I need to be available 24 hours a day. I can receive calls at all hours, sometimes from the police requesting a post-mortem. It can also relate to organ donation as well. Here in Northumberland, I'm supported by coroners officers who are employed by Northumbria Police, and I also have 2 great assistants as well who were appointed by the local authority. Next slide, please. So I was appointed on the 1st of October 2020. We still have the 2 areas in Northumberland, North and South, which is the split. The amalgamation is something we're working through, which should be conducted probably in the next year or so. We are currently located in Morpeth County Hall. We have a purpose-built, dedicated coroner's court, which I'd all welcome you to come and see. It's a fantastic facility. Karen's going to take us through some pictures shortly, showing what the facility looks like. In a past life, I've been an advocate at inquests all over the country, and I have to say it's one of the finest coroner's courts in the country, if not the best. We benefit now. Coroner's officers used to be located on split locations. They'd be based in Ashington Police Station, but we're now co-located in County Hall, right next to our registrar colleagues, which is invaluable in that collaborative approach that we're now able to offer. Next slide, please. If I pass back to you, Karen, on the next slide.
Yeah, that's great. Thank you, Andrew. Okay, so Andrew's already outlined that we've got new accommodation for the coroner service, which is located in County Hall in Morpeth. So historically, the coroner service in Northumberland for a long time was very fragmented, and it was delivered from a base in Berwick, where our previous senior coroner used to sit, and also in an office in North Tyneside, where we previously had 2 senior coroners, one for North Northumberland and one for South Northumberland and North Tyneside, and they were located in those different areas. On top of that, we had our coroners officers, who are employed by Northumbria Police, were based in Ashington Police Station, and the admin staff were fragmented too. So it didn't really lend itself to a very collaborative, joined up working output for the coroner service. And when we had an opportunity to work with the executive team in Northumberland County Council and to work with colleagues in property services as part of the refurbishment programme, it was an opportune moment really to outline what I thought was the dire need for the coroner service to have some modernisation, to come together in a central point, and certainly be located in a more convenient point for families to access. If you think about the role of the coroner that Andrew's brilliantly outlined there, a big part of that as well is that we are open and transparent. It's an opportunity for the family to ask questions when they come to an inquest, when they interact with the coroner. It's a really big part of the bereavement and the grieving process for families as well. It's a closure element that families can really appreciate actually when they're coming to terms with a loss. So to have a coroner's court which is accessible by all, fit for purpose, modern, fresh. We've got coroner's officers and the admin staff co-located, as well as that in a location in Northumberland, which is in the most populous part of the county, made complete sense. So we're very, very lucky to secure that backing from Northumberland County Council and that investment. And as Andrew's outlined, we've got a coroner's court, which we took delivery of, took the keys of back in October, and has been really successful and really well received since then. So we have inquests which are held daily in court. Court is a public open session. Anybody can come in and observe the workings of the coroner, the senior coroner and the service. And Andrew's already extended that invitation out to everybody to come and have a look around the court if you would like to. And we have inquests listed now well ahead, probably to beyond September 2021. This year that we're in at the moment is going to be interesting for us as a service as we come through COVID and come through pandemic restrictions and really get back into the normal way of work with jury inquests, etc. So that the court will really come into itself during 2021. So next slide, please, Chris. I've got some images and photographs to share with you now, which if you haven't been into County Hall lately, will hopefully give you a flavour of what the court looks like. Now, we are located in Block 2, ground floor, where IT and HR used to live a few months ago now. That might help you get your bearings. So our proximity in County Hall is brilliant because we'll be close to the reception. We're on the ground floor level, which makes it wonderfully accessible for everybody. And this slide that you can see is the entrance into the Coroner's Court. Next slide, please, Chris. We've also got a waiting room, which was part of the plans in terms of an average court day where we have various people attending, interested parties, maybe press teams, families, etc. It's really critical to have a waiting room, to have a dedicated space for people to congregate and meet. And we have a waiting room which is opposite the entrance to the Coroner's Court, which is a slide that you just saw previously. Next slide, please, Chris. Now, this slide shows us the inside of the Coroner's Court, and it is a flexible workspace. We have the ability to split the court into half. That image that you see at the moment is actually the front half of the court, and we have a gallery at the back end of it as well. We also have the ability to have flexible workspace in the Coroner's Court. We have a mover wall which can come across, and it just means that Andrew has a court that can be expanded if need be, if we have a jury inquest or we're expecting a larger gathering. And as well as that, for the local authority, if we would like to use the Coroner's Court or to use part of it, we're able to do that and have part of that space booked out for a multi-use purpose. But the image that you can see there, I hope you agree that it looks like a court, but it also has a more relaxed feel to it. It's not the typical oak panelled, wood panelled room that an old-fashioned magistrate's court can be like a criminal court. Because we have to be mindful that we're bringing families in. It's a stressful environment potentially for people. They may never have been in a court environment before. So I think it's important to be able to have a Coroner's Court which is just a little bit different, a little bit more family friendly. Andrew also spoke about his vast experience that he's had on both sides of the bench, really, and the different courts that he's worked within. And we're really, really proud to say that we feel the Coroner's Court that we've been able to deliver for Northumberland County Council and for our families in Northumberland is really top drawer facility that we will be able to use for many, many years to come. Next slide, please, Chris. So as part of the development, we've always had bereaved families at the heart of it. And we wanted to have a little bit of dedicated space that our families could use on a court day if they wanted some private space, if they felt a bit overwhelmed by the process, and they've got a dedicated room, which we call our family room. And you can see it's set out in a more relaxed style. We'll have a little bit more decoration that's going to go in there. There'll be the opportunity to have some refreshments in there as well. So it's really just a private space for the family to have, which we think is key and critical to having a successful coroner service. Next slide, please, Chris. And the last image that I've got for you today is the jury room. So we've spoken a little bit, Andrew spoke about Article 2 and deaths in custody, deaths in state detention, which would automatically warrant a jury inquest to take place. So we've got a dedicated jury room where we can manage our jury effectively. They can have a private space to consider the inquest, consider their outcome, and retire to. Now, the image that you're looking at here, it's set out in a COVID-friendly fashion, which is why we've got 3 chairs around one rather large desk. But ultimately, we can have up to 11 people who will sit in the jury room. Andrew also has some vision for this room in that we can operate this room as a second court if we are busy, if we have a backlog situation, if we need to catch up, and we can have 2 courts running parallel together. So they're all of the images that we've got to share with you today. And for the next slide, I'll hand over to Andrew, who's going to talk a little bit about the next steps for the coroner service.
Thanks, Karen. So you've seen the pictures of the court. One of the positives that to come out of COVID-19 has been the possibility to have hearings heard remotely. The law is very clear that the coroner needs to be present in court, but we've been able to conduct inquests and hearings where participants have been able to join us remotely using Microsoft Teams. Before Christmas, I heard an inquest where a family from Hong Kong were able to actively participate in their mum's inquest. We also had a hearing shortly in the new year where two brothers who now live in New Zealand were able to actively participate. The time difference was a bit of a challenge, but we were able to overcome that. And we have the facilities now where we're able to hear these inquests where ordinarily families simply wouldn't be able to join us, particularly at the moment, given the restrictions in place due to COVID-19. But they're now able to do so, and they really welcome that development. One of the other advantages of the court is we have our own dedicated Wi-Fi. So it gives us the potential to go paper light. So instead of producing an inquest bundle, I can generate images on a screen, either to assist an interested person, an advocate, or a member of the jury. We're looking to develop that IT provision further and have a dedicated coroner's website. But we have to make it clear when inquests are being heard. So we put them currently on the council website. At the end of the day, an inquest, it's an open hearing. Anybody can come and sit in the inquest and hear the evidence. Obviously, at the moment, with restrictions, we're unable to do so. Although, having said that, when we take into account social distancing, our court can take up to 18 people at any one time, which again just demonstrates the versatility and the size and you know, the thought that's gone into the court that we've got. Looking to develop closer working with our partners, in particular NHS colleagues. We had a useful meeting yesterday with two colleagues from the Medical Examiner Service, which we're looking to do on a quarterly basis. We meet on a weekly basis with Northumbria Police. We're looking to roll that out again to funeral directors as well, who are an essential part of the service. And as I've already mentioned and Karen's discussed as well, we sit next door to registrars, and it's invaluable to have that facility where you can simply pop your head around the door and raise a query and just make this a more streamlined service for bereaved families generally. I've already mentioned post-mortems, but we're looking to move on to the next phase really, and it's an exciting time where we're looking at post-mortem provision generally and a drive to having non-invasive post-mortems done, and we're exploring that locally within the trust in Northumbria as to whether they can provide that facility to us, and the trust have very reasonably agreed to undertake a pilot study which they're going to fund, and we're going to compare the results with an invasive post-mortem, and hopefully we can offer that service locally to bereaved families. Very fortunate here, we've been joined by Linda Dean, who's our first officer, coroner's officer, who brings a wealth of experience. She was a coroner's officer in Sunderland and in Newcastle, and she's brought the skills and talent she has to Northumberland. She's only been in post a matter of weeks, but we're seeing enormous advantages and changes thanks to her input. Assistant coroner provision is something we're looking to develop for resilience and planning for the future. We're going to do that as a cross-authority process together with Newcastle, where we're looking to appoint at least 3 assistant coroners. I'm very keen to bring in new talent and new blood, but also to give individuals opportunity to join what I think is a fantastic profession. I think it's really interesting work that we do, and hopefully bring along the next sort of coroner who could perhaps be Northumberland, Newcastle or Sunderland, and generally just taking it forward, working with Karen to improve the service generally for the bereaved of Northumberland. Next slide, please.
Thanks, Andrew. Just a couple of extra comments from me to further support what Andrew's already said. I always think it's worth pointing out that one of the key roles that the senior coroner leads on, obviously Andrew's there to investigate death and cause of death, but a big part of the coroner role is also prevention of future deaths, Andrew, isn't it, in terms of the reports and recommendations that you will write as part of your senior coroner role. And it's a look to the future as well, isn't it, in terms of how we can prevent deaths occurring. And if you feel like there is a matter to be reported, then that's something that you pick up, isn't it?
It is. It's one of the real differences a coroner can make. So if I think there's a risk of future fatalities, I can't in law make recommendations, but I can write a report to somebody who I think can take action. And it's something that's very much been encouraged by the previous chief coroner. I know that will be encouraged by the new chief coroner. And furthermore, we're enhanced in the North East because the deputy chief coroner is Derek Wendy, who's the coroner for Sunderland. So as the coroner service goes, we're very much enhanced in the North East. We're at the forefront of changes, and it's just all for the better, really.
Thanks, Andrew. And just as well to add to the list that Andrew's shared with everybody today, the coroner service and registration service in Northumberland, we are at the moment working with colleagues as part of the General Register Office. There is a central government agenda to look at digital transformation work, and we are collaborating with our GRO colleagues to look at digital transformation around death investigation and registration. And it's another look to the future as to how the service may well evolve, but ultimately, you know, for the betterment of bereaved families, really, and to make the process as slick and smooth as it can be for them. As part of today's presentation, we thought it was an opportune moment to talk a little bit about the excess death management work that Andrew and I have been involved in on behalf of Northumberland County Council and on behalf of the Northumbria LRF Forum as well. So as part of the Northumbria LRF, there is a death management group which has been established and has been in place since about March last year. The group meet weekly, and it's made up of representatives from key areas across the 6 local authorities from Northumberland, North Tyneside, Newcastle, Gateshead, South Tyneside and Sunderland. So across that group, we have coroner representation, service managers from registration, coroner and bereavement services. We've got funeral directors, NHS colleagues, emergency services, and everybody really who's part of that excess death management process. And the need, obviously, for a death management group is, I'm stating the obvious when I say this, but obviously during a pandemic, we've got an increase in the number of deaths over a short period of time. And it's very, very key and imperative that we make sure we've got a slick response. We're able to manage and cope with that enhanced demand. The death management group reports into the what we call the TCG and SCG. That's the tactical coordination group, and that's the strategic coordination group. And we report into them on a number of matters. We will flag up if we have any issues or concerns. We will request permission for certain actions. For example, if we have a need to deploy or commission temporary mortuary capacity across the region. But again, just to sort of reiterate that point that I hope has already been made by Andrew and I, is that very much at the heart of the death management process is that ongoing commitment to ensure that the deceased and their families are managed with dignity and respect at all times. Next slide, please, Chris. So this slide just outlines some of the detail around the objectives of the death management group, and we've spoken about the communication flow between DMG, TCG and SCG, which obviously incorporates local authority chief executives, multi-agencies and the Resilience Forum. We have a death management plan which is in place to effectively manage the situation that we unfortunately are still in at this moment in time. We've done some work around data modelling, which has been rather challenging but necessary to understand death trends and be able to have a educated look ahead to understand what the future pressure may be when we've gone through first peak and second peak of deaths in the region. We also have a red, amber, green RAG rating system, which would give us control and trigger points around if we have any critical points regarding death registration capacity, burial and cremation, mortuary capacity and body storage across the region. We've also looked ahead to develop what we call a PMART team, which is a pandemic multi-agency response team, which would really supplement and support our NHS, police, coroner and local authority colleagues if it came to body removals and body movement across the region, which we thankfully haven't had to deploy. But it's all about, the death management group actually is all about preparedness and being ready. And it's obviously good practice and essential practice in the current climate. Next slide, please, Chris. So as part of the death management group, we have a regular look at the mortuary capacity in Northumberland, and this has been a really key area. We look at the mortuary capacity in the region every day. We have great communication channels with NHS colleagues and Andrew and myself, amongst other people who need to have this information. We, as part of death management group, we did take a contingency of additional mortuary capacity for the first wave, and now we have a more targeted approach in terms of the mortuary capacity across the LA6. We've had resilience deployed most recently at the QE and Gateshead and south of the Tyne, and the arrangement that we have in place at Northumberland, which we outlined there as our business as usual, and we've got a small amount of surge capacity, has really met the challenge, to be honest. And our mortuary colleagues across the NHS sites have been fantastic in terms of effective management and being proactive and having great engagement with the death management group and the local authority. So the capacity has obviously increased and decreased over this period of time, but we have not felt particularly uncomfortable at any point with the mortuary capacity in Northumberland. As I said, it's been brilliantly managed. It's a great collaboration with NHS colleagues and local funeral directors too, who are very much worthy of a shout out at this point. They've contributed greatly towards effective body movement. You know, we haven't had situations at the mortuary where funeral directors haven't been collecting the deceased within a timely manner. It's really been a team effort which has paid great dividends for the county. And the Northumbria NHS mortuary capacity has really held firm during that second COVID spike, which we're sort of coming down and out of a little bit now, but it's been very well organised. Next slide, please, Chris. So this, one of the final slides that I've got for you is just the Northumberland death registration figures that we have seen over the course of 2020 and 21, and that slide gives you a little bit of an at-a-glance look as to where they've sat this year. So you'll see that with no surprise, we've been higher over the course of this year. I think we had 2 months, which was July and August 2020, where we were slightly lower than the 2019-2020 rates. But you'll see, you can follow that trend. I think we all know now that we had a spring peak, we had a dip in the summer, and then infections and hospitalisations began to creep up again in September, October. Obviously, once that happens, we see that the deaths will naturally occur a few weeks later, and that's reflected in the death registration figures that you've got there. I did note in Rachel's presentation, she spoke about, you know, hopefully seeing a significant reduction in hospital admissions over the coming 4 weeks, and then that translates into a reduction in deaths as well. And just for context, actually, when we did the slides, we didn't have the February death registration figures, but we do now, and we've completed 404 registrations in February. So it's decreasing a little bit from January 2021, but still ahead of the February 2020 figures. Next slide, please, Chris. And that's just a graph for you to look at the death registration over the current year, the black line, and over the previous 5-year average, which is in the blue line there. And you can see how we have really peaked in April and May 2020, and then a sharp drop over the summer months, and then September and October that familiar climb has happened again, but hopefully we're at that second peak and we'll be going in a downward trajectory going forward. Next slide, please, Chris. And that concludes our presentation. Unless Andrew has anything else to add, it's just to open the floor for any questions and leave our contact details with yourselves for future reference if you'd like to know anything more about the coroner service, about the registration service, about the excess death management process, or as Andrew kindly offered, to take up the invitation to have a tour of the court. We'd very much welcome your contact and engagement, and any questions if you would like to ask, we're more than happy to answer them now for you.
That's great. Thank you very much, Andrew and Karen. That's really interesting and informative and thorough report and presentation. I've certainly learned a lot from that, things I didn't know at all. So far, I've got 2 councillors. I've got Councillor Hutchinson and Councillor Rickaby. Hutch, do you want to take it away?
Yeah, first of all, my apologies for being late, Chairman. I did make it eventually, but yeah. No fantastic presentation, Karen and Andrew. The actual courtroom looks absolutely fantastic as well. It's purpose built, great. very interesting. I know it sounds sad, death is a sad thing, but it sounds very sad to say this, but it really opens your eyes as to what does go on behind the scenes. I'm looking forward to coming to a hearing as well, to actually see in person. You did mention, I think, Karen, that the courtroom could be split into two. Yes. So it could be possible to have other meetings in the other part of the courtroom. It could, yeah, Councillor Hutchinson. This has also been at the heart of the design, actually, in that we were very, very lucky to have support to develop the Coroner's Court in County Hall, and we'll be eternally grateful for that as well. But a big part of it is that we've got a workspace which has got a really good technical specification in terms of the IT and the audio visual capacity that it has as well. Andrew spoke about, you know, we've had interested parties and families who've dialed in from New Zealand and Hong Kong, and that's been facilitated by the audio visual equipment that we've got there. But we've also had an outlook where we're very, very happy. You know, the space is bookable, and the Coroner's Court splits in half. And we actually did a little bit of a test. Andrew might recall this, I hope. We pulled the wall over one day, didn't we? We've got to move a wall, which looks brilliant. It looks like a lovely wooden wall, actually. You would never think it was a temporary wall. And we hoovered on one side, we had the hoover on, and we listened in the other, and there's no sound transfer. It's really, really well specced out, and it's high quality. So we can split that room with confidence and know that each whoever's working either side of that wall can do so independently without any interruption from a noise pollution point of view. The family room can be booked out. We've got we didn't show it actually in the photographs, but we've got a meeting room which can be booked out and can be used by legal teams on the day when we have court, and the jury room can be booked out as well. I know Andrew's PA Jane Tate, she'll handle those sort of inquiries, so we can make sure we'll have no diary clashes with court work, etc. But very, very happy that this is a multi-purpose space for others to use, Councillor Hutchinson. But thank you for your kind comments as well. Well, Councillor Sesford will know where I'm coming from, because both he and I, one or two more, sit on the licensing committee, licensing regulatory committee, and sometimes we'll have panel meetings, which is rather like a courtroom scenario. Yeah. So it's good to hear. Sometimes we can't find meeting rooms to meet in, so it's good to hear that there's somewhere that could be possibly utilised. Yeah, absolutely. You know, let us know what your needs are. You know, keep in touch. If you want to come down, have a little look beforehand, please do. But more than happy to collaborate with you on that. That's fantastic. Keep up the good work. Great. Thank you.
Thanks for that, Hutch. Leslie, Councillor Rickaby.
Yeah, thanks. I think I'm switched on now. Thank you. Yes, I endorse everything that's just been said. Certainly, when John and I were asked whether this was a good topic to come to the committee, certainly I said it's, in my opinion, we all hear about a coroner's service, but do we really know what goes on? And I think the presentation this afternoon has been absolutely excellent, certainly given me an insight. But I was very interested in your comments about partnership with NHS Trust to explore non-invasive postmortems, because I know there are a lot of people who understandably get quite horrified when a post-mortem is suggested. At the moment, I think I'm right in saying you said the standard post-mortem is 95% is the standard is used. So I think my question is along the lines of, is there any possibility that in the future non-invasive would become the norm, and what would be the criteria to determine that a non-invasive post-mortem is done over a standard one? Thank you.
Thank you, Councillor. Very good question. We're going to face a real challenge in the next few years with regard to pathology services generally. For reasons which I think we can all understand, is doctors don't want to do pathology. So we're going to have a real shortage of specialists who are able to do invasive postmortems as well. That's on the other side of that is we've had huge advances in technology as well, where CT scans, MRI imaging is able to do a very effective non-invasive postmortem and produce a cause of death. When you speak to the experts about it, they do say that a non-invasive is great, but it does have limitations. And whenever you'll talk to a pathologist, they'll say that there's no substitute for actually opening up an individual and ascertaining the cause of death. So we're not quite there, but we will be. There are obviously faith groups who are very reluctant to have post-mortem examinations undertaken. We do have a protocol within the coroner's service, whereas we can have bodies transferred to an imaging centre where a non-invasive post-mortem can be undertaken. Sadly, if that doesn't reveal a cause of death, sometimes we need to revert to an invasive post-mortem. But you know, the reception to that, we've had situations, and faith groups have been very understanding and very supportive of that. We need to have the scan reported on by a radiologist, but ultimately it's the pathologist who will give us a cause of death. In answer to your question, yes, we are getting there. We're not quite there yet, but we are making huge strides, and obviously we're looking very keen to do that locally within Northumbria as well, and Northumbria is firmly on board, and hopefully we'll be able to have a solution to that in the very near future.
Andrew, thank you very much for that. I must admit, I thought about becoming a pathologist many years ago. That wasn't why I asked the question, though. And I do think, certainly as your comments about I was looking at on the faith aspect of, you know, I think it is a positive forward in an unusual environment.
Yeah. Thanks for that, Leslie. Very interesting question. I have Councillor Bowman hand up. Councillor Bowman, Les?
Yeah, thank you, Chair. I just want to say that I attended a coroner's court many years ago when I was in my 40s, and that image still is imprinted in my mind. And I felt like the victim. In many ways I was, because obviously I lost a loved one that I had to give witness to, but it felt like a criminal court. And I'm really pleased that you've actually changed the atmosphere. It is still formal, it is still what it's meant to be, but it's not intrusive, it's more welcoming, and that's a good thing. One of the things that really gets the participants in a court is nervousness. Obviously, questions are asked of them and they have to give an answer. And if they're really nervous, then they probably won't give the whole truth. Not that they are lying, but their thoughts aren't in full gear, as it were, because they're very nervous of the situation. And I'm really pleased that you've looked into this and you've really addressed it. And I want to thank you for that, because I'm sure that many residents of Northumberland and the North East would really appreciate it. Thank you very much.
Very good points, Les. Did Karen or Andrew, do either of you want to come back on to?
Just in the initial thoughts, and I know Andrew will want to add his own as well. It's what you've just said there, Councillor Bowman, really resonates with me, and I'm sure Andrew as well, because everything that you felt that day, it's never left you. You spoke about it being a little while ago, and it's a very, very clear memory that you have, and possibly a little bit of a painful one too. And we never want to put our families through that in Northumberland. We know it's challenging enough anyway when you lose somebody who you love. To go through an inquest process, it's so important for us to get it right. Yeah. And you probably find that the coroner service has turned a corner nationally, but certainly we've got huge drive and commitment to make sure that our coroner service in Northumberland meets the needs of our families. Now, just two things that I'll add, and then I'll hand over to Andrew. We are working with a charity called the Coroner's Court Support Service, and they are a team of trained volunteers who we will deploy on busy court days, and they work with families. They're trained to work with families to help them through that day, and they're dedicated to them, to their needs, to showing them where everything is, to explaining everything, and that's a huge plus that we've got in Northumberland now, because we're going to work with that charity. But also just some initial feedback. Andrew's been in post as senior coroner for Northumberland since October and has gone straight into the job, head and feet first, I hasten to add, and we've had some really lovely feedback from families, and this is attributed to Andrew and his manner in court with the families. and the amount of time that he's prepared to spend with them and listen to the questions. Any question can be asked, you know, to have that time and that interest and focus. So we've had some really great feedback, Councillor Bowman, so far from our families. That's immensely pleasing for me. And I'll hand over to Andrew. You might have something to add on that, Andrew.
Yes, I mean, sadly, Councillor Bowman, what you've described there isn't uncommon. The coroner's service was probably best described as archaic. It dates back to King Richard II. We had our most recent update in the Coroners and Justice Act 2009, which actually came into force in 2013. And there's been some huge developments in that period of time, most of all Harold Shipman, which sort of sent a rocket really to the coroner's service. And one of the most important things that came out of it is that families must be at the centre of the coronial process. And I think they were forgotten previously, if I'm being honest, and that has changed. We regularly attend coroner's training, and it's the message is paramount, is that the families must be at the centre of that process, given every opportunity to ask questions. Limited within scope, I have to say. Sometimes we do get families that ask questions which are out with my gift. I can't answer. We get families who are legally represented. We also get advocates, healthcare professionals who come to the court as well. And I think it'd be wrong of me not to acknowledge what a daunting prospect it is for them as well. I regularly remind them that they're not on trial. They're there to assist me with my process. I've already mentioned it. We had a meeting yesterday with colleagues from Northumbria Healthcare Trust, NSEC, and the medical examiners, who are doing great work. And that's an extra layer of scrutiny that didn't exist before the Coroners and Justice Act, and it gives families that extra opportunity to raise concerns in the care that their loved ones might have had. But one of the doctors did comment that her colleagues do feel daunted by the process, but as words filtering down, when those colleagues are coming to the court, they're giving evidence, and they realise I'm not a dragon, I'm not an ogre, I've got a duty that I need to undertake, that needs to be discharged. I want to hear their evidence, and families want to have the opportunity to see the whites of their eyes, frankly, and put those questions to them. So it's all positive for the area. Thanks
for that, Andrew. I can't see any more hands up, so I'd like to thank Karen and Andrew for. I've learned a lot from that, and it's been very interesting and a thorough report. And I, for one, will be taking you up on your offer and coming to have a look, and I'm sure many other people on the committee will do that. So can I say thank you very much for your time. I know it's a valuable time, but coming along here, and you've really explained it extremely well. So thank you both for the time you've given.
Thank you. Thank you.
Right, we go to item E on the agenda, the work programme. Chris, did you want to comment on Appendix E, work programme?
Chair. The work programme, I think at this point, sort of just for members to know what's coming up at the next meeting. We'll have Northumbria Healthcare's quality accounts and a report or a presentation from CNTW on how they've coped with COVID-19 and what they've learned and what they're looking at going forward. And that will be the last meeting before obviously the election in May. So if there's anything I think any members would like me to take a note of for when we come back in June, I'm more than happy to speak to a member if they've got anything they want to raise. But the work programme at the moment is just to note for the next meeting.
Thank you for that, Chris. And I'll just repeat what Chris says. Any member, just get in touch with either myself or Chris or Leslie, and we'll see what we can do to get an item on the agenda for you. Any urgent business? I don't have any. Chris, was there any other urgent business you had?
Not that I've been informed of, Chair.
Thank you, Chris. All I can say is the date of the next meeting is Tuesday, the 6th of April, which, as Chris has said, is to be the last one before the election. Could I thank you all for your time? I think it's been a really interesting meeting as usual. We've got some great subjects on here, and thank you all for your time, and we'll see you on the 6th of April. Thanks now.